Well, let me ask you this. So you've discussed that there are some women who do need to be on estrogen replacement when they go through menopause, depending on the age, especially when they go through menopause, and that window of opportunity so that their body doesn't have to readjust to the presence of estrogen. Is it something that you should get a sense of how much estrogen do you need as a woman? Should we measure your levels while you're in the prime of life?
Well, we know some of the classic symptoms of estrogen deficiency, which many women will get over, such as the hot flashes, insomnia, mood swings. Not every woman will get over that, and some women, I think 20 or 30% of women will continue to have those types of symptoms forever, and they're, either they live with it or they find other medications. But what we're talking about here, though, is let's keep things in perspective. Once a woman turns 60, 65, if you look at the leading causes of death, or what do you think the leading cause of death is in a woman over 65?
I haven't thought about it really.
What would you say is the top one or two?
I can't tell you.
Cancer, heart disease.
Pick
up one of those two.
Well, heart disease or cancer or something like that.
Okay, how about would you?
Heart attack.
Heart attack, okay. So many women will answer breast cancer, one or two, but it's like number 8. And you know what comes before it? All the cardiovascular diseases, stroke, heart attacks, peripheral vascular disease, diabetes. So those are the conditions that if a woman gets on estrogen replacement early enough, that's the ground zero. Can we retard those conditions from occurring? And so it may come as sort of a trade-off. You kind of aim at the most likely problem and hope that you don't develop the problem that is unlikely at a particular age. So I think you have, just like everything else, there's a calculus of the benefit versus the risk of a particular treatment. But a lot of it is quality of life, and so if your quality of life is miserable because you're low on estrogen, for example, that's a personal decision that you have to make with your physician about whether it's something for you. But I think that women should not fear estrogen replacement. I think the problems and the misunderstandings, the misreporting of these studies and the controversies has probably set many women up to be harmed because of fear, and their quality of life is going to be diminished, and it'll take a major second opinion, say from another study, to help some women. But I think there is a generation of women right now that probably are going to be harmed because they just fear the whole estrogen issue. And physicians who are not familiar with it, who don't keep up with it, I go to all the meetings, have a hard time explaining it to patients.